This is little tricky question, which is not a subcutaneous mycosis. Chromoblastomycosis, maduromycosis, porotrichosis, they are all called subcutaneous mycosis. That is a point we need to appreciate. What is a dimorphic fungus? Expected question. Histoplasma. This is a useless question once more. Adenovirus, who will remember चाबी का number count किसको याद रहेगा? Room number 5, room number 7, 1 or 7, 40, 41. I think a similar kind of a cruel question was in Comet K. Hemorrhagic enterovirus leading to conjunctivitis belong to which subtype? Bhagwan ko chhod do. So, subacute sclerosing encephalitis is measles. Typically in the antemortem diagnosis of rabies, what technique will you use? Direct immunofluorescence you will use to demonstrate. Ticks are fundamentally Casimir forest disease. Toxoplasma gonorrhea is maximum during third trimester, transmission risk. Larva currens is strongyloides stercoralis. How many answered Toxocara canis? This is 15 years back when I wrote PG entrance. From that day it is the same confusion. What does Toxocara lead? What does strongyloides lead? जरा एक बार ध्यान से देखना पड़ता. Parasitology chart में. After what age a person can give consent to an act not intended and not known to be likely cause of death of grievous hurt? I didn't understand the question. I mean, you can give consent for getting hurt to an act not intended and not known to be likely cause death or grievous. Are they trying to combine two questions, one on consent, other on grievous hurt, and by mistake a hybrid statement came up? Is there any consent to be hurt also, which is not grievous? Hannah? So I didn't understand that. What was the question? Electric burn at the point of entry is basically called endogenous burn. Is it filigree or endogenous? At the point of entry. I know lightning is filigree. I didn't check that. Actually, I didn't get time to check the explanation of what is this endogenous. Eucerin is what? Eucerin is found in Calotropis gigantea, is what you need to basically remember. Yeah. Regarding Davidson body is what you find in females, not in case of males. The vaginal tissue on the glans penis can be demonstrated by cleaning the part with what? Exposing to Lugol's iodine. McNaughton is all about what? Criminal responsibility of a mentally ill. Skin blister is typically seen in case of the barbiturate poisoning. Right? Then Chief Judicial Magistrate, this is our favorite question. One question on the magisterial powers of the judges. Which judge can order for how many lashes is very clearly defined. So 7 years. Blast injury, tympanic membrane is gone. In India, when do you call viable? 210 days of intrauterine life. Pseudo-hypoparathyroidism means what? Fundamentally, there is a receptor level resistance to the action of the parathormone. There is a reason parathormone levels are elevated, and since it is not acting, it leads to hypercalcemia. Cardiomyopathy with stress is called cardiomyopathy. Right? So, what is cardiomyopathy? You have seen in the movies now. Suddenly a bad news will come और माँ वो सुनते ही मर जाती. Nowadays उतना emotion नहीं लगा रहे. Recently I have seen once more after a long time an emotional movie. What is that? Junior NTR movie. Nannaku Premato. Oh, last scene was like cardiomyopathy only. Huh? So a dead father is asked to wake up, wake up, wake up, and after 10 times junior NTR cries, Rajendra Prasad will open eyes. Then I thought, Acha, must be one of our MBBS doctors has given death certificate. That is the reason the patient is waking up in the last scene. एक बार देखना है, so good. So the people who have this Thakur-Subbo cardiomyopathy, what happens is suddenly when they get a stressful news like you got first rank in PGCET in spite of not studying, they will get a heart attack and die. So tell all your friends, I am already having Thakur-Subbo cardiomyopathy. Don't tell about the news. If I happen to be in the top 10 ranks, otherwise you will die. So be sure. Non-ischemic cardiomyopathy it is called. Lennox-Gastaut syndrome में multiple seizure types will be there. EEG will show a 3-head spike pattern. This is called 3-head spike pattern of Lennox-Gastaut. Multiple epileptic types will be there. They will also have mental retardation and regression. It is basically a pediatric epilepsy. Normal pressure hypercalcemia, abnormal gait, dementia and urinary incontinence, a combination you will come across. 20-year-old male with bilateral loin pain and there is a hematuria 24 hours after sore throat. We are waiting here for IgA nephropathy wala question. Sympharyngitic hematuria is IgA nephropathy. Eschar formation is a feature of scrub typhus. Sodium glucose, superb question doctor. Once more this question will come in APPG. मैंने बोला ना, one of the sugar वाले गोली पढ़ के जाना एग्जाम को, राइट? नहीं तो गब्बर पूछेगा एग्जाम हॉल में कितने गोली है बेटे. तो if you don't read and go, what is exenatide, what is pralinitide, what is sitagliptin, ramagliptin, lakshmanagliptin, all these things he will ask. What is their mechanism of action? Without that there is no paper. मैं बोल रहा हूँ. Once more when you, I will show you once more. Kerala PG also I will show you one of the diabetic, oral diabetic drugs. Tamil Nadu PG and JK PG. फिर भी आप नहीं पढ़ के गए तो you are responsible. So doctor, canagliflozin class is used. What does it basically do? Normally kidney का function क्या है? Sugar को until a particular threshold value, it will try to reabsorb and retain sugar. If you give this, you are creating glycosuria. So if one tablet is given, it will cause 119 grams of blood glucose per day to be eliminated to the urine, which is the way 476 kilocalories are being lost, is what you have to basically remember. So what is the gold standard for pulmonary embolism? Pulmonary angiography. Pathergy test means what? Typically, there is a bump or a bruise that lead to typically develop in the area of the stress, just like Auspitz sign, which is used in Besset's. Telescopic fingers are typically found in case of psoriatic arthropathy, which is also called arthritis mutilans, is what need to be remembered. Acute kidney injury may serum creatinine, when will it peak? This is a little dirty question. Who will remember? खाली guess मारना पड़ता. 3 to 5 days or 24 hours, whichever comes to your common sense. Okay, so don't worry on this question. Camel's diarrhea is E. coli. Then lenalidomide is the brother of thalidomide, which is typically used in case of myelodysplastic syndrome, which is a poor prognosis like 5q deletion, is what need to be remembered. Lenalidomide is also used in multiple myeloma. Then familial Mediterranean fever is colchicine. Even LKG boy knows this. Then which is not seen in polycythemia vera, polycythemia rubra vera में WBC में दिक्कत नहीं है, वो CML नहीं है, but it belongs to that myeloproliferative states. It can predispose to development of myeloid leukemia, but it by itself it is not. So you will have tendency for leukemia, hyperuricemia, thrombosis, but not infection. One hepatitis B, hepatitis C, without that no paper. So envelope antigen is basically for what, doctor? Ongoing viral replication. Axial calcification is basically silicosis. Beck's triad is seen in cardiac tamponade. Then what are the JVP findings in cardiac tamponade? Many times we discussed this question. Absent X descent is the feature in, is not the feature. Absent Y descent is the feature in cardiac tamponade. तो स्टिल मौका मिल गया, 2 मिनट बात करेंगे जेवीपी के बारे में इन कार्डियक टेम्परेचर. गिव मी द बोर्ड प्लीज. Atrium contracts. What do you get? A wave. When atrium is contracting, what is ventricle doing? Last one third of diastole, it is getting filled. After the A wave is over, ventricle got fully filled. Tricuspid valve closes, and what do you get basically? End of this first heart sound. Then atrium relaxes, that lead to X descent, where the pressure falls down. Then the great vessels will drain into atrium, and that lead to development of V wave. Then after that, tricuspid mitral will open, and atrium drains into ventricle and loses pressure. That is called Y descent. If the cardiac tamponade is there, what is the hallmark of cardiac tamponade? All that fluid will lead to diastolic collapse of ventricle. That means atrium want to fill into ventricle during diastole, but ventricle is collapsed. It won't let the atrium to fill into ventricle. So if the atrium doesn't fill into ventricle, how will its pressure will fall down? It won't fall down. If it doesn't fall down, you don't have Y descent. So absent Y descent is a feature of what? Cardiac tamponade. और जरा स्टोरी है वो छोड़ देंगे क्योंकि already hundreds of times we revised it in the online video library. NEETPG.com, you go and check the JVP and review it if you have done this question wrong. But when you are Dr. Murali Bharadwaj question, students, JVP wrong karna, we will take a social responsibility to resign from teaching. Be sure. There are some topics you should not answer wrong when your teacher is a MD in general medicine and taught you well. So doctor, that is very important. So what is the cause of a fasting hypoglycemia? What is accept about it? Excess glucagon lead to hyperglycemia. Why will it lead to hypoglycemia? Examiner thinks that we didn't come prepared to exam. Then what is the most common type of motor neuron disease? Amyotrophic lateral sclerosis. Preeclampsia, you will use intravenous labetalol. Ondansetron acts on 5-HT3 receptor. Rose spots are typically seen in case of the enteric fever. And different mutations in the same genetic focus lead to identical phenotype is basically called allelic heterogeneity. Allelic heterogeneity is what need to be remembered. Different mutations in the same genetic locus cause similar phenotype is basically called allelic heterogeneity. So the vast majority of the obese people, what will they have? Last time I told you, leptin, ghrelin or giherlin, what do you call? Ghrelin, not giherlin, like girlfriend. No. So leptin is important for what? Eating food and suppressing the appetite. Suppressing. Leptin, ghrelin is hunger hormone. This is appetite suppressing hormone. Lakshmana's wife Urmila had very high levels of leptin. That's the reason she didn't feel anything until Lakshman returned back from Vanavasa. There is little epical importance. So leptin is similar. Leptin typically levels will be elevated in those who are obese. Receptor level resistance will be there. Though it is a appetite suppressant, its levels will be high in case of obesity, because it is at the level of the receptor level at which leptin cannot work in those who be in the people who become morbidly obese. You got my point? Imidazole can decrease the, but still doctor, let me tell you, this is a very tricky question. Those who answer this will get little edge compared to others. This is a rate limiting MCQ in the tomorrow's exam, like seat limiting MCQ, sorry. Then imidazole can decrease the clearance of digoxin. Quinidine, procainamide, imidazole, these three are antagonistic to digoxin. They lead to digoxin levels to get elevated. So you need to be careful while co-administering. Osborne waves in ECG, hypothermia, you all know. But in our APPG, they will give direct Osborne tracing and ask you to recognize it. Right? So where will you recognize Osborne? QRS complex के बाद T wave के बीच में ST segment J point होता है ना? That is the point where you discover the presence of this Osborne wave, is what you have to basically understand. What is 1.5 syndrome? You call it as a internuclear ophthalmoplegia only if MLF only is affected, medial longitudinal fasciculus. Along with MLF, if abducens also got affected, you call 1.5 syndrome. Okay, so what is MLF, what is internuclear ophthalmoplegia, everything is there in your anatomy2medicine.com video library. Then doctor, this is another dirty question. I mean, not that easy to crack. Idiopathic hypereosinophilic syndrome and eosinophilia myalgia syndrome. Typically, how do you differentiate? Basically, it is the eosinophil count. So, I leave to you in the literature, how do you define hypereosinophilic syndrome? Absolute eosinophilic count greater than 1500, which persists longer than 6 months without any identifiable etiology for eosinophilia, along with the involvement of organs. That defines hypereosinophilic syndrome. Then what defines eosinophilia myalgia syndrome? So just run through the review and there lies the answer. But this eosinophilic syndrome also, now slowly tough questions are starting. Now hypercalcemia treatment, everybody is supposed to know. So if you give saline and a loop diuretics lose calcium, thiazide diuretics retain calcium in the body. So if you only give loop diuretics, he becomes dehydrated. So add saline to that is considered to be the management of choice. Boys above 16 years who are too difficult to be handled are placed in Borscht. Second Wednesday of October every year has been designated as World Disaster Reduction Day, right? So one of the national days will come. Then obesity index, which is height independent, is corpulence index. Once more, all obesity indices is a favorite question any number of exams you go. Trend of events with the passage of time is basically called as mock test results. With the passage of time, little improvement in curvature should come. So line diagram. Global Hunger Index. Examiner is bored with PQLI, HDI and अभी एक नया इंडेक्स लिंक निकाला, मालूम है क्या? और पहले बार सुन रहे, हम भी पहले बार सुन रहे. तो undernourishment, child underweight and child mortality. You average the 3 divided by 3 will give you the global hunger index, right? So What is the recommended daily intake of vitamin A? Expected question. This is 950 micrograms. How many answered this wrong? Pado. Still another 28 days is there. This is one question. Obsessive, compulsive, neurotic toppers. OCNT. Will not let this question go wrong. Right? Such questions, 5-6 questions wrong करे तो खत्म, खेल खत्म, दुकान बंद और निकल. Next रम्मी में बैठ जाओ. तो 12th 5-year plan. Oh, this is also unexpected bouncer. What is the main objective? Universal health coverage. It is a right of everybody to have a good health, family planning, skilled birth attendants, antenatal visits, vaccines, etc. etc. Doctor, this is also another disgusting question. Unexpected, bouncer, you can't help it. Only English में अगर कुछ English आ गई तो आंसर कर सकते हैं, वो भी जरा कॉमन सेंस का इस्तेमाल करके, वो कॉमन सेंस कभी भी राइट नहीं होगा. That is a common rule. So, what is semi-indirect, indirect, what is semi-direct, semi-indirect, indirect, direct, indirect. Direct lighting means reflection of the walls, doctor. Indirect lighting means reflection of the ceiling. And intermediate waves is reflection of both of them. Why all this for getting PG seat? PG seat आने के बाद पैसे कमाते ना, इतना पैसे कमाने थे. अरे डॉक्टर, if you are a really good consultant, start a nursing home. At least let me start talking positively about what is the advantage of getting PG seat. Every time I talk negative about क्या है, that is another waste life. I used to say no, but good part I'll tell you. इतना पैसे होते हैं, आप टैक्स नहीं पे करते, और you will be running here and there in panic that every March tax time आ गया, क्या करना, पैसे क्या करना. So somebody will advise, put it in apartments खरीदो, रियल एस्टेट में लगाओ तो थोड़ा सेव करोगे. तो रियल एस्टेट में लगाते तो so you and your spouse will both go to see Loda Beleja, the big apartment complex in the outskirts of Hyderabad. So that time you will be thinking, darling, how much should be the direct light falling, indirect light falling, so that our money is safe without the government taking it all away. So that is the idea of examiner in giving such questions. So be sure. So direct, indirect. ऊपर से गिरने वाला direct होता नहीं होता, wall से गिरने वाला, this is added on confusion. Wall से गिरने वाला direct है, ऊपर से गिरने वाला indirect है. क्या है डॉक्टर? English भी they don't know properly to frame. So what is world population supposed to reach? 8 billion. Each billion is how many crores? 10 crores, sir. Doctor, don't disappoint me. आप करोड़पति बनने वाला डॉक्टर सोच रहा हूं मैं. I will go and tell my students are, oh, multi-millionaires having a top hospitals, etc., etc. I am telling everybody in the world. You don't know what is billion, what is million. Million is 10 lakhs. Billion is 100 crores. India is 1.2 billion population, means 120 crores. And world population is supposed to reach 8 billion. That means 800 crores is the world population. So let me tell you, this is not in your hand. Nobody will know. Preparation से होने वाला चीज नहीं है. इसके पहले वाला question, this is completely hopeless. Like that you are saying, अभी तक 10 to 15 questions must have been already bounced शुरू हो गया. The sweet part of honeymoon is over. We'll go to the next part. What international agency is for the human and natural resources in the development of human and natural resources? UNDP, United Nations Development Program. Asbestos, crocodile. Obviously crocodile is dangerous, no? Crocodile is mesothelioma. Health communication where 4 to 8 experts बैठ के they talk about their expertise while all of us sit and listen is basically called panel discussion. not difficult question, easy to answer. What is the density of population? Impossible. You have to quickly check in your room how many are writing a PG entrance and decide a number. So 382. ये तो bouncer हो जाएगा सबके लिए. For calculating, I told you ना, positive predictive accuracy, negative predictive accuracy, relation of it with sensitivity, specificity, इसके बिना पेपर होता क्या नहीं होगा. वो फॉर्मूला मालूम है ना, पॉजिटिव प्रेडिक्टिव एक्यूरेसी एंड स्पेसिफिसिटी सेंसिटिविटी के बीच में रिलेशन क्या है, इनटू प्रिवलेंस एंड द प्रिवलेंस रिलेशनशिप. यू नो द फॉर्मूला? नो, लास्ट टाइम वी डिस्कस्ड. सो टीपी बाय ऑल पीस, टीपी प्लस एफपी विल गिव यू पीपीवी. टीएन बाय ऑल एन्स विल गिव यू एनपीवी. Major mental illnesses include all these things but not psychoneurosis. This is the most beautiful question, doctor. How many answered this wrong? Super, मजा आ गया, मजा आ गया. वो भी टीवी वाले क्वेश्चन में रॉन्ग करे बोले तो what is the eligibility? Eligibility to be topper from the bottom. Okay, what is the difference between MDR versus PDR versus extra DR? एक जरा ध्यान से सुन लेंगे ताकि नेक्स्ट एपीपीजी में अगर आ गए तो यू विल गिव क्रेडिट. अरे मुरली सर आपको कैसे मालूम है? ऐसे क्वेश्चन पूछा जाते हैं. ऑल द स्टूडेंट्स आफ्टर कमिंग आउट से ऑल क्वेश्चंस केम फ्रॉम मुरली भरद्वाज पेपर. वाह वाह वाह, जैसे क्यों नहीं आते? Because ultimately we will pick up from all the other state entrance papers and examiner also picked from there only. So when our picking and his picking are from the same basket, it will be similar. But it is up to you to decide. Mock test में भी wrong करके actual exam में भी wrong करे तो that is your fault. So what is polydrug resistant TB? Resistance to two or more anti-TB drugs, but not to both isoniazid and rifampicin simultaneously is called polydrug. Multidrug बोले तो क्या है? At least two of the most powerful anti-TB drugs, that is INICET and rifampicin. At least these two को आगे तो multi है. Other than these two, at least two को आगे तो poly है. So what is XDR TB? It is MDR TB plus along with multi-drug resistant TB. Along with that, at least quinolone family, any member of quinolone family, and at least one of the second line anti-TB injectable drug like capromycin, capreomycin, kanamycin, capreomycin or amikacin. That defines the XDR TB. एक क्वेश्चन जरूर आएगा डॉक्टर. MDG तो आप तो पक्का पक्का पढ़ के जाना, राइट? डॉक्टर मुन्ना भाई IAS, MBBS नहीं. This is a common topic even for civil services preparation also. So doctor, eradicate extreme poverty, गरीबी हटाओ is number one. Achieve universal education, सबको इंग्लिश मीडियम स्कूल को भिजाओ is MDG 2. Then promote gender equality. Already gender equality क्या? Toxicity है. Girls are dominating boys completely. So maybe gender equality means boys should get reservation in entrance. So then reduce child mortality. Improve maternal health is 5. But only paradox is mother should come first, child should come later. But थोड़ा reverse है. 4 is child, 5 is mother health. So I leave the literature for you. All the MDG goals पक्का पक्का पढ़ के जाना और एक बार जरूर आता. Straight same question will come in APPG, no doubt. To provide immediate care to all newborns at birth, we should have a newborn care corner like coffee day within the delivery room is what you need to remember. Chi-square test में 5 minus 1 into 4 minus 1 will give you degree of freedom. Rodents are implicated in Lassa fever. ICMR expert group suggested an intake of 1 gram of protein per kg body weight, assuming that the NPU will be how much, doctor? 65. When do you basically take crude death rate? We call mid-year population. When do you call mid-year? 1st July. Oseltamivir prophylaxis, whenever you are giving to the entire household, it is basically offering a specific protection against the influenza. Giving vaccines, giving vitamin A, they are all examples of specific protection. Primary vector for transmission of malaria in urban area is what? Stephen's College is there only in the city. City means Stephen College girls you call. So Stephen's is college, urban. Now, cystic fibrosis is not sex linked, autosomal recessive. What type of shock may cardiac output will be high? Septic shock or distributed shock may you will have a increased volume. Last time also we told in Comet K that one question on types of shock is a favorite question. This is a difficult question. This is not for you. Clinical etiology, anatomy, pathophysiology for chronic venous disorders. What is the CO stands for? First of all, what that CEAP stands for, unless he told, we don't know. Right? So, छोड़ दो. ये तो just थोड़ा teasing करने के लिए दिया. Examiner ने actually दिया. But such questions in exam, don't worry, nobody will answer. Whenever there is a lateral facial wound, facial nerve injury, if it is there, what do you want to do? The protocol is to do primary repair. So it is a dextrosaline which is basically used in order to manage as a maintenance fluid, burns maintenance fluid. What are the areas wherever the lymph node, at which level oral cavity and lips get involved in carcinoma? Typically you are having submandibular, submental are called level 1 doctor. Superior spinal accessory and superior jugular chain is basically called 2. Mid jugular is called 3. 1, 2, 3 are the ones which are basically involved, is what you have to basically remember. What percentage of salivary stones are radio opaque? Cruel question. We know kidney stones, gall stones. Already in them what percentage is opaque and lucent already is a cruel question. Salivary stones. So if you answered this wrong, don't worry, it is 80%. It is also that Govinda question. Then 53-year-old multinodular goiter, warm nodules are there. What is the chance of this warm nodule being malignant? Once more, Govinda question. No one can answer. Did anybody answer rightly? Oh, you are all malignant, obsessive. Let online students know that all of our offline students answered here correctly. I think they also answered correctly. They are also equally, super equally obsessive and malignant about winning exam. Invasive breast cancer. Atypical hyperplasia is not a factor, but you answered ductectasia. Metaplasia you answered. No increased risk of except, okay, atypical hyperplasia leads to I think this question we will recheck. I was also not quite convinced on this. Yeah. One GCS, Glasgow Coma Scale scoring is definitely going to be asked in the entrance. So, spontaneous to voice to pain and none. And similarly, motor response, how do you want to grade? So, I hope all of you answered this GCS Wallace question correctly. Anybody wrong? Sure? If not, this question examiner is going to ask Apgar score. That's the second possibility in APPG. Chain of flakes recently in Comet K also was the same issue. Chronic pancreatitis. where you have got alternating cicatrizing and dilatation of the duct is what you have to basically remember. Cold storage times doctor, अगर बेली एंड लव सर्जरी पड़े तो एक अच्छा लाजवाब टेबल रहता ट्रांसप्लांटेशन में UCW यूनिवर्सिटी ऑफ विस्कॉन्सिन solution. So it is the kidney which has got the longest cold storage time is what need to be remembered. For how long you will tell the couple to abstain or use alternative reproductive mechanism, contraceptive mechanism after sterilization operation? 12 to 16 weeks till the backup sperms will be ready to impregnate. So that's the reason you need to take care. Hinchi classification. Govinda question. Nobody will answer this correctly. So what is Hinchi classification? Complicated diverticulitis. You call whether pericolic abscess is there, any pelvic abscess is there, purulent peritonitis is there. They are the deciding factors to decide the diverticulitis severity, which is basically called Hinchi's classification. Chronic liver disease. How do you want to basically screen for hepatocellular carcinoma? Alpha fetoprotein and ultrasound are the two things. There is a diagnostic algorithm. How you do the follow-up? अभी आ गया. कॉमेड के 2016 में क्या क्वेश्चन पूछा? डिओडिनल स्विच के बारे में. Those who didn't attend कॉमेड के paper, we hosted it on our YouTube channel, youtube.com/online-MBBS. You can always review. Excellent questions, 200 questions. It's worth reviewing them and solving them once. Okay. Duodenal switch was a question asked last time. So biliopancreatic diversion अगर आप करें तो maximum amount of weight loss you can achieve in case of the bariatric surgery is what you have to basically remember. A newborn baby has an anal orifice closed, meconuria is there. So what is the best way to manage? You have to do a colostomy and create an opening. Then only the fistula will heal. Then a patient falls high risk group for DVT and pulmonary embolism. What are the risk factors? If at all as a clinician, very high risk of DVT cases you see is post-ortho surgery. Even though the orthopedic guys give heparin pre-operatively and post-operatively and coverage and all that, some people are having a very high proclivity for developing DVT. What are the most common mediastinal tumor? Thymoma. What are the 4 T's in anterior mediastinal tumors? Thymoma, teratoma, terrible lymphoma, retrosternal thyroid. They are all considered to be anterior mediastinal tumors. What is that? Overall, what is your answer? Lympho. No, doctor. Thymoma is more common than lymphoma as an anterior mediastinal tumor. Most common overall mediastinal tumor is thymoma. Urogenic is more common. No, doctor. There is a posterior mediastinal tumor, most common is urogenic. Overall also urogenic. I don't know. I'm not sure. Let's check. Since you are all fighting on this, overall I'll just check the percentage. But as per I thought thymoma is most common is goes in parlance. So I didn't focus on it. Gold standard क्या होता है? Gold standard is not, do you wear gold every day? Is not the routinely done investigation. It is a investigation against which all other newer investigations are compared to know the relative efficacy of one investigation over that of the conventional format. 24-hour pH recording is gold standard. Sporadic primary hyperparathyroidism is commonly due to adenoma, doctor. Sporadic, then most prevalent incidentaloma is which one? Non-functioning adenoma. Lot of times whenever you do CT abdomen or ultrasound, you may end up in discovering adrenal mass. But all adrenal masses are not FIOS. That's what you need to appreciate. Lowest recurrence rate, where will you have? Obviously, you have done truncal vagotomy. You have removed electrical connection to the stomach. Also did anthrectomy. Dono kare to lowest recurrence. Target-like lesions are multiforme, as all of you know. Peripheral nerves, glowing stalking pattern, along with thickening, is a feature of lepromatous leprosy. Type 1 lepra reaction is type 4 hypersensitivity, type 2 is type 3 hypersensitivity. 1 plus 4 or 2 plus 3 should be 5, as all of you know. Then go to the next.